So we're going to shorten this session down to 10 minutes just because conscious of time, and allergens have been mentioned quite a few times today, so we're just going to do a very quick panel to what we'd originally thought. So we're going to go straight in and come to Lauren with regarding allergens. So we know that allergens have been a thing since 2014, so 11 years on. Where are we now? Best practice, challenges, barriers, resources. What's your kind of view within your remit with it?
Yeah, so from a patient perspective, obviously allergens are crucial. You know, it's something we take really, really seriously. We've got a central dietetic team within Medirest, and they have, although we do have the usual types of training like the food hygiene standards, we also have a specific training module that our dietetic team have prepared for anyone that handles food, particularly on a ward. This includes food hypersensitivities, so it does focus on the 14 allergens, but also those that may be intolerances or sit outside of that. So I think for us, it's obviously something that's absolutely crucial to get right, and we're always looking at ways to kind of develop our offer and support people that are, you know, suffering from allergies, but also outside of the regular 14.
Yep. Thank you. And that's something, isn't it? That's a new term that we're all trying to adopt, that food hypersensitivity, isn't it? So it covers celiac disease, intolerances and allergies. So Sarah, talking about the caterers and the clinical teams, it's everybody's responsibility. Can you share what you've perhaps done in your trust with the clinical side of it? Any staff training at clinical level?
Yeah, so we identified probably 12, 18 months ago now that we felt there was a gap really in some of the training there, especially for the clinical staff around the allergens. So Mike and the team have developed an internal e-learning package, so it isn't an accredited piece. But it is something that we've used to supplement the training there to make sure that they've got adequate awareness of it, really, because ultimately they're taking the patient meal orders. They are admitting patients as well, so capturing the allergens at the point of admission, and they are, in some cases, serving the meals. So for us, they should absolutely have the same awareness as caterers.
And have you had the buy-in from that? Have they been engaged?
Yeah, so it's been implemented as essential to role training. If there's any clinicians in the room, it's really difficult to get anything added to mandatory training. But we've also managed to get the buy-in from NHSP as well, so it is part of the NHSP training for our trust now as well.
Fantastic, really good, thank you. Charlotte, so as a parent and the public perception, what's your views of how the NHS and hospitals manage food allergies?
Well, we hear from families around, obviously, from different hospitals, and one that's particularly really stuck with me is that there was a child with a number of different allergies, and the parent was told to go and find their own food to bring in because there was too many allergies. I think it was only 3 allergies that this child had, and they weren't able to be fed on the ward, which is bad enough that as a parent you've got to go and find food, let alone go and find food for your child as well. So yeah, but obviously that's, and also for a parent in hospital, we've got families who've like celiac and other things, and actually trying to find food as a parent in hospital that you can actually buy is really limited. Costa is in pretty much every hospital, but that actually you can hardly buy anything as a celiac in that shop. So actually, even as a parent or a visitor, to buy anything on site is a real challenge.
Yep. Just thinking about accessibility to information then. So we know a lot of trusts will have their own staff intranet with allergen information on. It might be on their public hospital page. QR codes have been spoken about today. Can you share, to all of you I guess, any practices that you've seen that have really kind of worked well, or what you're doing in your own establishments?
I think for us, one of the challenges we have is that service users generally are not able to have mobile devices on the wards. So where other hospitals may have QR codes, like you say, we tend to build it into our menu boards, and it's also on the tablets at the point of the meal ordering as well.
Yeah, so we have specific menus created that are printed and laminated and available on the wards. So we have a standard menu, and then we have supplementary menus for special diets. We do also obviously use digital meal ordering in our sites, so we do have the added benefit of being able to like filter through. So at the point of choice, we can actually give some really comprehensive options and guidance to the patient around what they can eat with us.
Fab. And when you think about eating out nowadays, quite often you'll get asked, do you have a food allergy, several times throughout that meal, won't you, when you arrive and then during when the order's been taken. Do you feel we're very good at that in the NHS? Do you think there's room for improvement with that? Whether that's clinical staff asking the patients or...
I think there's room for improvement, if we're honest. I think as a catering team, we understand the importance a little bit more. So I think in our retail outlets and things, it is asked at the point of service. But I think when it comes to obtaining the patient meal order, I don't think I'd have the confidence that that's asked every time. It's captured at the point of admission. We do get a database on a daily basis from the Power BI team. And that talks to the patient meal ordering. So from a catering point of view, our kitchens are confident that we're sending something suitable for each service user, but I'm not confident that it is asked at the point of taking the orders.
Yeah. Okay. Charlotte, did you want to come in?
Yeah, so Sophie, when she was little, had as a baby, had a dairy and soya intolerance, not allergy, but she sort of grew out of that by the age of about 3. But when her chemo started, it triggered it back again. So she was back as obviously of dairy and soya intolerant, but I don't recall ever being asked when we were admitted at any admission of 3 hospitals, did we actually have an allergy to food or anything. I think it was down to me to present that first. I don't recall ever being asked. I mean, I was asked a lot of information, but I do not ever remember that. So I do think it is really important as to where that information is stored as well. I know it's bad enough trying to share patient information with a number of different hospitals and everything. So actually, where is that information stored about that child or patient has an allergy or an intolerance to any food, and how is that information going to the right person when they're taking the meal ordering? I'm not sure if that is across the board that's happening.
Yeah, if it flows as well and keeping it up to date as well and accessible, because a lot of the caterers don't have that access to the patient data either, do they?
Yeah,
so.
And she started her journey without obviously having anything, but then that changed. So again, where is that notes being updated and who is that being shared with?
Yep.
So, because intolerance, we've got to remember there is intolerances as well as obviously allergies.
Absolutely.
As well. So there is, but that information being shared is crucial, I would say.
Yeah. Well, if we get it wrong, then the consequences are quite dire, can't they? Do you think an allergy champion or expert in trust would help? So where we've got the food safety lead as part of the food standards. I'm just playing devil's advocate a little bit, but just putting it out there. What do we think, Lauren?
Yeah, no, that's something that we really would encourage. So we're at the moment we're just on a kind of new journey with our dietetic team, and that is something they're looking at. HSC champions we already have, allergen champions, and also special diets. So that's something that we would love to empower our own teams to be able to be confident they have the right knowledge to enable them to advise patients. But just touching back on what you just said there, Charlotte, we actually do make sure that at each service time, our ward hosts go to see the nurse in charge on each ward, just to update, just to check the diet grids. Has there been any change since the last meal service? Is anyone nil by mouth now? Has anything changed? Anyone moved? Because we know that communication is key, and the future obviously would be that we would kind of sync all of our digital platforms and have it digitalised. But at the moment, we do have to rely on our ward hosts being really embedded into the ward team that are operating at the time.
It's that ward culture, isn't it? Making sure everybody's on the same page, working together. Okay, so how about another, just putting it out there about food sampling, so sending hospital food off to be tested for allergens. And my reason for asking that is around the may contain element of it. So I think a lot of hospitals will have an allergen-aware menu, an allergen-free menu. But what about those patients outside of the 14 allergens? How do we guarantee that risk of may contain is safe? Can you provide any examples in your trust? How do you manage over the 14 allergens if you get requests for those? Sorry, hard question.
Never know who's going to speak.
I'll go there. So how we would manage is that we would obviously first start with our standard menus and then go to special diet menus. If there are severe or multiple allergies, we do have a free-from range. But outside of the 14, we would encourage our on-site catering teams to contact our central dietetics team, who would be able to give specific advice and bespoke advice if it's either complex multiple allergies and intolerances or something that sits outside of the 14. But we are lucky to have that resource that we can kind of fall back on, and the team are there to support and provide advice to those on site to give them the confidence they're giving the appropriate options.
Thank you. I appreciate that was very fast. And Tim's giving me the nod over there as well to wind it up. So we'll end there. And I think long term, it's thinking about what we can do with the HCA, NHS England, BDA, and what allergens and food hypersensitivity work we need to do together. So thank you very much.
Thank you.